Hi, horse friends. Have you suddenly noticed that your horse's stall is much wetter than normal? Maybe you are removing twice as much soaked bedding, filling the water buckets more often, or watching your horse stop to urinate several times throughout the day. Is your horse simply drinking more because the weather is hot or the diet has changed? Or could excessive urination be an early warning sign of kidney disease, PPID, or another medical problem? Excessive urination in horses is known as polyuria. It often occurs along with polydipsia, which means excessive thirst or increased drinking. Veterinarians commonly refer to these two signs together as polyuria and polydipsia, or PU/PD. Although increased urination can have a perfectly manageable explanation, it can also be one of the first visible signs that something is changing inside your horse's body. The challenge is determining whether the horse is truly producing more urine, urinating more frequently, or simply creating a wetter stall for another reason. So, how much urination is too much for a horse? What causes it, and when should you call your veterinarian? Let's start with an important distinction. A horse that urinates frequently is not necessarily producing an excess total volume of urine. A horse with true polyuria produces more urine over a 24-hour period than expected. This usually creates larger wet areas in the stall or forces the owner to replace substantially more bedding. The horse will generally need to drink more water to replace the fluid being lost. However, a horse experiencing pain, bladder irritation, urinary stones, or an infection may repeatedly posture to urinate while passing only small amounts. That is frequent urination, but it may not be true polyuria. Straining, dribbling urine, passing blood tinged urine, repeatedly stretching out, or showing signs of discomfort deserves prompt veterinary attention. Before assuming anything is wrong, think about what has changed around the horse. Has the weather become hotter? Is the horse exercising more and drinking additional water afterward? Has the horse recently moved from dry hay to lush pasture? Are you soaking the hay or feeding soaked meals? Did you introduce alfalfa, clover, electrolytes, or additional salt? Has a new automatic waterer been installed? A horse consuming more water will usually need to eliminate more water. That sounds obvious, but owners may not always recognize how much hidden moisture is entering the diet. Fresh pasture contains considerably more water than dry hay. Soaked hay, soaked beet pulp, hay pellets mixed with water, and wet meshes can all increase total water intake, even if the level in the horse's water bucket does not change dramatically. The type of forage can also affect urine production. Legume forages such as alfalfa and clover are generally higher in protein and calcium than grass hay. Horses fed substantial amounts of these forages may produce more urine, and their stalls may develop a stronger ammonia odor as excess nitrogen from dietary protein is eliminated. That does not automatically mean the horse has kidney disease. It may simply mean the kidneys are responding normally to the horse's diet. Salt and electrolyte intake also influences drinking. If a horse begins consuming more salt, eating an electrolyte supplement, or using a salt block more frequently, thirst and urine production may increase. Certain medications, including corticosteroids and diuretics, can also cause a horse to drink and urinate more. This is why the horse's full history matters. A wet stall should never be evaluated in isolation. Now let's look at what happens inside the horse's body. The horse's kidneys continually filter the blood. They remove waste products, help control electrolyte levels, and regulate how much water remains in the body. Most of the water filtered by the kidneys is reabsorbed and returned to circulation. Only a small portion leaves the body as urine. This system is remarkably sensitive. Even a small reduction in the percentage of water reabsorbed by the kidneys can cause a dramatic increase in urine production. The kidneys can also adjust the concentration of the urine. When a horse needs to conserve water, the kidneys normally produce more concentrated urine. When the horse has consumed more water than the body needs, the kidneys produce more dilute urine. If the kidneys lose their ability to concentrate urine effectively, the horse may begin producing large amounts of dilute urine. To avoid dehydration, the horse must then drink more water. This is why owners may notice excessive thirst and excessive urination at the same time. One possible cause is chronic kidney disease. Fortunately, chronic kidney disease is considered relatively uncommon in horses, but it can be serious and progressive. During the early stages, a horse may appear completely normal, except for increased drinking and urination. As the disease progresses, additional signs can include weight loss, reduced appetite, lethargy, dehydration, poor body condition, swelling under the abdomen or along the legs, changes in the coat, or an unusual odor from the mouth. However, a wet stall alone does not diagnose kidney disease. Veterinarians commonly begin the investigation with a physical examination, blood work, and urine analysis. Blood tests may include measurements of creatine and blood urea nitrogen, which are all waste products, normally removed by the kidneys. Increases can indicate reduced kidney function, although these values must be interpreted alongside the horse's hydration status and other findings. Urine analysis is especially valuable. It can reveal how concentrated the urine is and whether it contains abnormal amounts of protein, glucose, blood, inflammatory cells, bacteria, or other substances. Your veterinarian may also recommend an ultrasound to evaluate the kidney size, shape, and internal appearance. Depending on the horse's signs, additional testing may be needed. Kidney disease is not the only medical explanation for excessive urination. In older horses, increased drinking and urination may be associated with pituitary pars intermedia dysfunction, commonly known as PPID or equine Cushing's disease. PPID is an age-related hormonal disorder most frequently diagnosed in older horses over 15, although younger horses can be affected. Other possible signs include delayed shedding, a long or curly hair coat, loss of top line muscle, a pot-bellied appearance, abnormal sweating, lethargy, recurrent infections, slow wound healing, foot abscesses, and laminitis. A horse does not need to display every classic sign. In fact, the early stages may be extremely subtle. An older horse that suddenly begins drinking and urinating more should be evaluated for PPID, particularly if you have also noted delayed shedding, muscle loss, or recurring infections. Diabetes mellitus can also cause excessive thirst and urination, but true diabetes mellitus is considered rare in horses. This is different from insulin dysregulation, which is much more common. Because several hormonal and metabolic conditions can overlap, diagnostic blood testing is essential. Another possibility is psychogenic polydipsia. This is a behavioral pattern in which a horse drinks excessive quantities of water without a primary physical need to do so. The kidneys then eliminate the extra water, resulting in a consistently wet stall. Psychogenic polydipsia has been associated with boredom and prolonged stall confinement. A horse may repeatedly play with the water, drink as a displacement behavior, or consume water simply because there are few other activities available. If physical disease has been ruled out, increasing turnout, forage availability, movement, social interaction, and environmental enrichment may help. But psychogenic polydipsia should be a diagnosis of exclusion. In other words, it should not be assumed until the horse has been examined and medical causes have been properly investigated. There is another important issue we need to discuss: water restriction. Some older recommendations describe withholding water to see whether a horse can concentrate its urine. However, owners should never conduct a water deprivation test on their own. Restricting water can be dangerous, particularly if the horse has kidney dysfunction, is already dehydrated, is experiencing hot weather, or has another underlying illness. Horses should normally have continued access to clean, fresh water. Any controlled water deprivation or concentration tests must be directed and closely supervised by a veterinarian. So, what should you do if you think your horse is urinating too much? Begin by gathering objective information. If your horse drinks from buckets, measure how much water you provide and how much remains after 24 hours. Account for spilled or contaminated water. If the horse uses an automatic waterer, ask your veterinarian whether temporarily monitoring intake with measured buckets would be appropriate and safe. Pay attention to the size and number of wet areas in the stall. Notice whether the urine appears unusually clear, dark, cloudy, bloody, or foul smelling. Watch the horse urinate if possible and determine whether the stream appears normal or whether the horse strains, dribbles, or seems painful. Record recent changes in hay, pasture, grains, supplements, salt, electrolytes, and so on. Also monitor the horse's appetite, weight, manure production, energy level, hair coat, sweating, and overall behavior. A short video of abnormal urination can be extremely helpful to your veterinarian as well. Call your veterinarian promptly if the increased drinking or urination is persistent, unexplained, or accompanied by weight loss, reduced appetite, lethargy, fever, swelling, dehydration, muscle loss, delayed shedding, or reoccurring infections. More urgent veterinary attention is warranted if the horse strains without producing a normal stream, repeatedly attempts to urinate, passes blood, shows signs of colic, stops eating, becomes weak, or appears severely uncomfortable. The main takeaway is that a wetter stall is not a diagnosis. Sometimes the explanation is as straightforward as hot weather, lush pasture, soaked feed, additional salt, or a change from grass hay to alfalfa. But persistent excessive urination can also be an early clue to kidney dysfunction, PPID, medication side effects, or another underlying problem. Knowing what is normal for your individual horse is incredibly valuable. If you clean the same stall every day, you may be the first person to recognize that something has changed. Do not dismiss that observation simply because the horse still looks healthy. At the same time, do not panic over one unusually wet stall. Look for a pattern, gather useful information, and involve your veterinarian when the change persists or is accompanied by other concerning signs. And most importantly, never limit your horse's access to water unless you are following direct veterinary instructions. We are not veterinarians, and this video is intended for educational purposes. If your horse is drinking or urinating more than usual, contact your veterinarian for an examination and appropriate diagnostic testing. And remember, I am also not AI. If you listen closely, you can hear me breathing.